One positive case of coronavirus has been detected, has been confirmed in Kerala. This is a very important update because so far we've been hearing about suspects being caught and their tests being run. But right now we seem to have gotten a confirmation on one positive case of novel coronavirus which has been detected in the state of Kerala. He's the Associate Professor, Postgraduate Institute of Medical Education and Research. Dr. Mahesh, thank you so much for joining us. We've just got an official statement from the Health Ministry stating that a novel coronavirus case has been detected in Kerala. Could you offer some comments on that?
Yeah, the information we have till now is from the PIB's press release. But this is a significant development, and it also shows that the surveillance system that was put in place is working. So this case could have been detected. But I would like to reiterate that there is no need to panic. Kerala's health system is really good, and the Nipah also they showed that they can contain. A lot is to be done because from the preliminary information we know is that the student was returning from Wuhan. So he or she must have already been isolated, and all the healthy close contacts need to be quarantined, and an epidemiological investigation needs to be done, and the flight that the passenger came with. So a lot is to be done, but there is no need to panic. The surveillance system, detection system, and the risk communication is working well, and I think the response till now is also good.
Your sense on the infrastructure and the medical surveillance that is in place right now, it's adequate? You're saying across the various airports that it's currently taking place at?
Well, as far as the entry surveillance is concerned, that we do the screening, that is adequate, and that is as per the International Health Regulation 2005's advice as well. So there is no need to panic, and the people have already been asked, those who are coming back from China, to report if they have any symptoms of flu-like symptoms or fever. So that should also work, and the detection system is also working because the number of labs in the VDRL network has increased from 1 to 5, which have the test kits and the controls which can perform these tests, and one of them is in Kerala in Alappuzha.
All right. We have the management of Thyrocare as well joining in, Dr. A. Velumani. Thank you so much for chatting with us on this issue, Dr. Velumani. Any comment you would like to offer on the fact that what is the kind of tests and checks and balances we have in place to detect coronavirus?
There are not really many labs are equipped to do. The kits are not available in market commercially to buy and do. Only, as I just now heard, 5 laboratories in the country are empowered to do, and I was told one in Kerala. It is not the diagnosis which is the problem. It is the infection which is the problem, and it is prevention which is the priority. There are people coming from China in general aircraft. In general aircraft, even if 2-3 are having infection, in a journey of 10 hours, this infection is likely to contaminate many. Not only people coming from Wuhan, people who have joined on board subsequently. So there is a very big challenge for identifying and isolating all symptomatic. Even those who don't have a symptom also need to be isolated, because the symptoms might take some more time after getting the infection. So the expertise is not needed much in treatment. Expertise is much needed in isolating segment by segment. And the ones who have higher level of symptom need to be segregated from the ones who still not have an onset of the symptoms. So I have a reason to believe it's a very big logistical challenge more than true a therapeutic challenge.
Is a country like India in terms of preparedness to deal with a problem like this?
I am afraid we must be very underprepared for the ones which moves fast, or the ones which replicate fast, or for the ones whose virulence is less. We probably have complete control, but then if things are not in order, it is likely to enter through ship ports, it is likely to enter through airports, it is likely to, even people who are in Dubai also is like Dubai airport. I can visualize a dozen number of infected moving from one gate to another gate. So it is a concern. I'm sorry for if I am panicking, but then there appears to be a challenge of identifying and quarantining such patients, for which government should focus without worrying about anything else, because once it goes much deeper into the country, into districts, it will be very difficult, because at least in metro cities, in airports, we have some facilities to isolate. Otherwise, it would be a very big challenge.
Mahesh, Dr. Velumani, many thanks for joining in and offering your comment on this developing news. The first case has been officially detected in the state of Kerala, and Velumani is raised some red flags about preparedness and about the issue of isolating the patient adequately.